really one of the hallmarks of this is how much this physical occupation has been not really just situated online, but really dominating physical public space. That's something that we have seen sporadically throughout the pandemic, but we haven't seen it on this scale, and certainly not on this scale globally.
Do you think it's a question of fatigue around the pandemic, or is there something more at play?
There's no doubt that the pandemic has led to a buildup of frustration. But really, if you look at what is at the core of this, it's anti-government sentiments. It's especially grievances about people feeling told what to do with their bodies. And so this is actually a much longer standing issue than really just the pandemic. It's something that we really see in the first anti-vaccination movements, which really formed in opposition to vaccine mandates.
With the role of social media, I mean, that of course has spread the notion of these protests, but what about medical and health misinformation? How much is that fueling these protests?
Yeah, I mean, people talk a lot about medical misinformation, but I think what that misses is also the role of political misinformation. So it's quite difficult really to disentangle those two elements. One thing I would say about the current protests, especially the protests in Canada, that they're not really just about the particular mandates that are facing the truckers in Canada. It's actually more broadly tied with far-right conspiracy theorist groups as well. And one thing that's become quite evident is that a lot of these are actually inauthentic coordinated accounts that are contributing to this as well. So we have bots, we have fake accounts, there's evidence of political interference in countries like Bangladesh, Romania. So even though we can see an actual physical occupation taking place in Canada and many parts of the world, what we can see with social media is that many other like-minded groups are actually leveraging, manipulating the situation for their own political ends.
And does that do a disservice to the discussion around governments mandating some of these restrictions?
I think it really does, because as soon as there's evidence of political interference, especially at the state level, it does place questions around the demands and the questions that are being asked. And I think there are some valid concerns and questions that people have. And the more that other groups hijack and co-opt the meaning of the protests or the occupation and change the messaging, it really does dilute and actually damage some of the more legitimate grievances that people might have in this situation.
Deeply embedded in that sort of more right-wing conspiracy is the belief of this yearning for a golden age, a return to a period of time that many feel has been lost. Is that a big driver?
With this particular case, I think that's less of an issue. I think what you're seeing much more here is something, as I mentioned earlier, that is central to opposition to vaccines really throughout history, which is much more of an emphasis on body sovereignty, the individual really conceiving themselves as an autonomous being, really opposing any idea of state intervention and the state trying to control what they do with either their bodies or their children's bodies. And really that's something that we've seen play out certainly with vaccine mandates for the last 200 years. And it's central here if you look at actually what started the protests again. So sometimes you do see that idea of looking back into kind of ancient times, whether it's real or imagined. But I think in this case, really, if you look at the central concerns that started the movement, it's much more about anti-government sentiment, really opposing any idea that the state should be telling them what to do with their body.
That's fascinating that you point out about the historical precedent for this kind of protest and resistance. You know, what periods of time over the last 200 years would we have had these examples?
Yeah, so the original anti-vaccination league emerged actually in response to a vaccine mandate in 1853. And that was a mandate that was really emerging regarding smallpox vaccination and requiring infants and eventually all children up until the age of 14 in Britain to be vaccinated. And, there were many legitimate concerns that people had at the time. Many of them were similar to today, but there were also concerns about religious purity and concerns about vaccines. And again, what you saw was really all of the resistance that emerged in terms of coordination and vaccination leagues as a group were really always emerging in opposition to mandates. And the more strict the mandates became and the more they were enforced by law, the greater the opposition. And that's something that we see continually playing throughout time. It emerged in Britain originally, and then shortly after it was followed in America. And then obviously on social media, the very big difference is now that opposition is not really so much a collective, it's much more networked and coordinated. And the difference that we're seeing now, particularly with the protests occurring, are that a lot of like-minded groups can then co-opt these networks very easily, because we've got things like Facebook pages, Facebook groups, increasingly Telegram, which is much less regulated. And when there's common experiences and grievances that people have, in this case, it's very much about anti-government sentiments and political ideologies, anti-globalist sentiments as well, it really does mean that these like-minded groups can then hijack these protests and then try to maneuver it for their own political ends.
Good to talk, Stephanie. Really interesting. Thank you so much.
Pleasure.